Well, good morning, everyone. The clock in Sullivan Township says 9 a.m., so we'll call this Grey County Committee of Management meeting to order. Welcome, everyone. It is March 14th. Just to remind members of the committee of your obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare it at that time. We have no delegations this morning. Our first report is the LTCR CM 0523 titled the 2022 long-term care write-offs for uncollectible accounts to be received. And that'll be recommended that the write-offs in the amount of $49,007 as outlined in the report be approved. Can I have a mover for that, please? Moved by Councillor Hutchinson and second by Councillor Nielsen. I think, Marcus, you're on the floor for this report. Good morning.
Good morning. Good morning, everyone. I'm going to walk through the committee report for the long-term care write-off of uncollectible accounts. So kind of going through it, I'm just going to be going through it from top to bottom. No real change in the direction of how we're kind of walking through it. But essentially what this report is and what this is doing is that this is writing off all of our 30-day plus accounts that we have with our residents for our accounting policy, and for us just to do because the ministry requires it at year end. So balance owing from residents with no repayment activity are written off at year end for accounting purposes, and staff continue to work on collection even after this. So just to give a highlight as we're walking through this is that while we have these numbers on here and we write it off at year end, they are reapplied as of the first of the new year, so in January of 2023 and we continue to collect and we continue to work with the residents to collect these funds. This isn't the total amount of 49,000 isn't an amount of saying, oh, we can't collect any of it and we're giving up on it. A lot of those ones, as we walk through, have a form of a payment plan or have a form of collection that is ongoing, minus a few minor ones, which we'll talk about when we get down to the chart. So background and discussion part, the staff in long-term care review accounts receivable based on monthly and attempt to work with residents to minimize any accounts that are in arrears. With the Ministry of Long-Term Care, we are able to, when we do write off accounts that we can no longer deem accountable, the ministry covers 50% of the arrears relating to the basic accommodation. Unpaid balances related to preferred accommodations, ancillary service such as cable, telephone, hair care, they're not eligible for ministry reimbursement. For the 2022 fiscal year, we have the chart here, which lists a total of $49,007. Grey Gable at $32,435, which is surmised in 4 accounts. We have Lee Manor at $13,122, which is surmised in 7 accounts, and Rockwood Terrace, that's $3,450, which is 1 account. Of these accounts, there's only one that is actually being sent to the ministry for uncollectible, which is with Grey Gables at an amount of $1,596. Outside of that, all of our other accounts that we have that are considered in the write-off category are ones that we are still working with them to collect, and we are working with either the PGT, as many of them are on, which is the public guardian trustee, or we are working with the family members or the residents themselves. So with the public guardian trustee, so we have a section here for the PGT delays. So a growing trend across the homes is the number of residents requiring public guardian trustee PGT designation, and that's due to them needing assistance with financial oversight or budgeting, and they don't have a family member in place to be able to do that with them. PGT will assess the request, and once approved, will take over the residents' financial payments. They'll handle all their financial needs, as making sure that all their bills are paid for. This process takes on an average 4 months until a request is taken under guardianship. So it results in the balances growing in more of an outstanding balance, as we have 4 months of waiting for somebody to take control of the accounts because typically in those 4 months, no action can really happen, or we can't collect on anything until that's happened. Pending as well, the resident's financial situation, the accumulated outstanding balance can take months to years for full balance repayment as the PGT assesses their financial standing to deem how much they can give us to pay towards the outstanding along with their current just living one. So we typically with what's happening across the 3 homes when they are under PGT, their current expenses are covered. It just happens that we might get for some of these ones, we might get an extra $100 a month to go towards their outstanding balance. If their balance though sits at $1,500 and that kind of stuff as an outstanding, well, we're talking about 15 months of collection. Still something that we want to keep because we still want to collect it, and there is a plan and there is a timeline in place. However, though, it again though still appears on this report on an annual basis. Long-term care office staff work diligently with PGT to arrange payment plans that would pay outstanding debts in a reasonable time frame. However, this is really beyond our ability to control. It's the PGT's final discretion and as well the residents' financial situation for us to kind of go from. So again, in summation, that's $49,007 that's being listed as the write-off one. We have one account of those that actually will be submitted to the ministry as uncollectible, while the remainder are being reapplied and are being pursued for collections and have payment plans with them on that. So at that point, I'm here to take any questions from the committee.
Okay, thank you, Marcus, for the report. Questions from committee members? Mr. Warden, go ahead, please.
Thank you, Mr. Chair. Thank you for the report, Marcus. I'm wondering how far back is our oldest account?
So through you, Mr. Chair, the oldest account, and we go off of the reports that we get from our current system. So we do have accounts that are 120 days in arrears. So that would go back to August. Now that amount does pile up more. I believe the oldest one, I'm just checking here. The oldest one is about 160 days. So just about half the year is the oldest one that we have on that list. Sorry,
I apologize. I meant like what year? I know on the chart you've got in the report, it goes back to 2016. Are there accounts prior to that that are still collectible?
That I would have to get back to you on, Mr. Warden. I don't know exactly if we have any there. From the reports that I have, the reports that I have here, I would say no, but I can double check to make sure for you.
No, that's fine. That's fine. I was just curious to know how long we allow these accounts to stay on the books, but that's fine. Thank you.
Other questions from committee members? Jen, I have a question for you. With the growing trend for the access to the public guardian, how is that process initiated?
Thank you. Through you, Mr. Chair, and I may just look to one of the EDs to just back me up here. It's been a few years since I've supported this, but we have social workers in each of the long-term care homes that assist our residents and their families as they transition. And the family or the social worker will help to reach out to public guardian and trustee. Public guardian and trustee does always look for a family member support or a family or friend, someone who will support the resident that is part of their kind of circle of care before they take them on as a client. And I believe we just reach out to public guardian trustee and make application. Karen, or yeah, okay. Does that answer your question, Mr. Chair?
Yeah, partially, Jen. I guess I'm looking at the competency part of it. Who makes the determination that the client can no longer look after their finances?
Right. Again, the social worker and the physician support us through that process. And then there is capacity assessors who are a third party that are skilled and certified in the area of coming in and doing an assessment to be able to make that final determination that someone is no longer cognitively able to manage their either personal care decisions or financial decisions.
Okay, thank you very much. I see Mary Lou's hands up.
Thank you, Mr. Chair. Because I was here in 2016, I can speak to the older write-offs. The process has changed over the years. It used to be that they only wanted us to write off something that we had exhausted all our repayment efforts. And they've changed their process. So we could write off now anything that wasn't collected up to the end of December, as Marcus has shown. And if it's basic accommodation, they pay us their share. And then if the resident still lives with us, we write it back on. And then we attempt to collect throughout the year. It's a bit of a different process. And so the amounts that were written off in 2016, they were deemed uncollectible. So there was no write back on.
Thank you. Any other questions? All in favor of receiving this report? That is carried. Thank you. We now have LTCRC M0623 regarding long-term care director update be received for information. Can I have a mover, please? Moved by Warden Millen, seconded by Councillor Keaveney. Jen, we'll turn it over to you.
Great, thank you, Mr. Chair, and good morning again, committee. This is an update since our last meeting, and this is just an update for information. So I'm sure that you have all noted that this month, yesterday, I think, actually marked the 3rd year of the COVID pandemic and our response measures. And as we reflect on the pandemic and the challenges that we've overcome, we recognize the efforts and strengths of our residents, families, and team members. We do now have many tools and resources to protect us, protect ourselves, including a high level of immunity through vaccinations. There is a new COVID-19 variant that has not been associated with a change in severity of illness, but is highly transmissible, and more individuals may get infected as it becomes the main variant in Ontario. Our homes do continue to be strong and maintain vigilance to ensure safety and well-being of our residents. Strong and consistent infection prevention and control measures remain in place, including audits, universal masking, screening, and testing. And just a little bit of update, and I won't go through every line and bullet point in the report, I'll just kind of hit the high points. We do continue to receive COVID updates and directives and guidance from the ministry and from Ontario Health. So at the end of January, we did receive a significant update related to the COVID long-term care pandemic response guidance document. So the definition of a confirmed update was updated. The definition, and I guess the point of interest there is historically, all that it took to trigger a full outbreak was one resident or one team member with a positive COVID test. And now it's 2 or more residents with an epidemiological link in a 7-day period. So there needs to be evidence of transmission within the home area. The definition of when an outbreak is declared over has been changed from 10 days to 7 days. There were clarifications added around non-roommate, close contacts, isolation strategies around dining, physical distancing, that kind of thing. There was guidance that allows public health leaders to use their discretion in their advice and direction around communal dining and programs and activities. And then there's a guidance of the management of mixed outbreaks. And this is something that long-term care across the sector has been experiencing that is unique to this year over the last 3 years. And that is that we are managing not just COVID outbreaks, but also influenza and other respiratory illnesses such as rhinovirus and a bunch of others that I've learned to read their names, but not necessarily say them, that are all really like the common cold. In the middle of February, the Chief Medical Officer of Health issued a memo regarding the importance of vaccines, influenza and COVID-19 vaccinations and antivirals. And of note, there has been updated guidance that allows for our residents that have difficulty swallowing to have the antiviral medications either mixed or crushed. And that is new. And that is something that was limiting some of our residents' ability to be able to take the antiviral medication, was that they couldn't be crushed. So that was excluding some people from that option. Since our last meeting, we have not had any COVID-19 outbreaks, although we have had other respiratory illness outbreaks. We do continue to do our daily screening, both active and passive, and we do still require rapid antigen testing for all 3 homes for anyone coming in the home. And I think that that's an important surveillance and protective measure that we will continue as long as the tests are available. And we're conducting over 2,000 tests a week. Infection prevention and control, our 3 IPAC and wellness leads are now on site at each location and becoming familiar and becoming parts of the teams at each of our homes. And they're working closely with our clinical specialists and the home's leadership teams. And that's a really exciting addition to our teams. Diversity Canada is a global leader in infection prevention control and has a long history of supporting their services in the healthcare sector. And Diversity was recently awarded the chemical supplier contract within our 3 homes. And the transition period started on February 14th at Grey Gables and was wrapping up last week at Lee Manor. Updates around staffing. All 3 of our homes had leadership members attending the regional job fairs that were held across the region. And our homes continue to welcome student placements and opportunities with colleges that are in our local and surrounding areas. We continue to have a focus on recovery and wellness, and that'll continue to be a focus over the coming months. Accreditation is still high on our list of priorities, and we're in the first steps of the accreditation journey. We are actively completing our self-assessments. The self-assessment is essentially a gap analysis that will help us develop our action plans that we then submit to Accreditation Canada. And then Accreditation Canada will come in and do a survey, an in-person survey against those action plans. The Fixing Long-Term Care Act. In early February, the Assistant Deputy Minister released a memo regarding proposed amendments, and these amendments to the regs and the act of the Fixing Long-Term Care Act. Those are bulleted here. We have not yet seen actual language. The proposed regulations are a summary, and so some of the specifics around what exactly the legislation will look like is still unknown. I did have an opportunity to provide some feedback and kind of learn from the ministry on what is being proposed. I believe that all of the proposals are manageable for our 3 homes, and we may need to make some decisions about whether or not we would take advantage of some of the flexibility that's being proposed in some of the staffing qualifications. They are not must, they're permissive regulatory changes, so to allow some flexibility. And when we know exactly what those are, I'll bring that information back to committee and we can discuss it more thoroughly. The Advantage Ontario's Administrator Program has been updated to include a course related to emergency planning under the regulations that were updated last April. And we've been asked to present a course in the June offering and the October offering around emergency management planning and be able to share our resources to the future leaders of long-term care. So it's an exciting opportunity. And the Advantage also posted a webinar for municipal councilors, and that webinar information has been circulated to committee. Partnerships continue to be a really important part of the work that we do in long-term care, and we are active both regionally and locally and provincially. An exciting highlight that I'd just like to point out, the Provincial Infectious Disease Advisory Committee on Infection Prevention and Control, there's no shortages of acronyms in healthcare, is a multidisciplinary committee of healthcare professionals with experience and expertise in infection prevention and control. The committee advises Public Health Ontario on a number of areas and best practices, supporting hospitals, long-term care, and community-based health organizations. And I'm really proud that our clinical specialist, Dana Leach, has been invited to support this collaborative work and best practices for IPAC for long-term care homes. You've heard the news, and so I'll just highlight again that we were really pleased to be part of the Grey County YMCA Employment Services program for the local workforce development, and we're pleased to be recipients of an award at the Economic Developers of Ontario Conference in Toronto, and recently participated in their celebration ceremony where they recognized 37 of the students who have graduated and from their PSW program, and all of them are employed locally in long-term care or community care in Grey Bruce, which is really exciting. Overall, the initiative provided 137 participants with free employment support, access to essential skills training and personal support worker training, and it was funded through the Ministry of Labour, Immigration, Training and Skills Development. And it was truly a collaborative effort, and really pleased to see that work happening. And the Ministry of Labour, Immigration, Training and Skills has asked the leadership of Grey County and YMCA Employment Services to provide an overview summary to their staff. So that's really exciting. And we continue to be thankful for the support of Council, this committee, the CAO and senior management, and to all our residents and staff as we hopefully are actually moving into recovery and from pandemic and into whatever the future may bring. So that is the update for today, and happy to answer any questions if there are any.
Thanks very much, Jen, and congratulations on the Award of Excellence. Certainly well deserved. All of the work that the entire team has been doing. It's hard to believe it's been 3 years, through the pandemic, and hopefully, as you indicated, we're on the right side of things. Questions from members of the committee? Must have been a pretty comprehensive review of the report. I'm not seeing any questions. All in favor of receiving the report? That is carried. Thanks very much, everyone. We now have report LTCR CM0323 regarding the long-term care operational report from December 15th, 2022 to February 14th, 2023 be received for information. Can I have a mover, please? Moved by Councillor Patterson and seconded by Councillor Nielsen. All right, I believe, Dana, you're going to take us through the first part of the report. The floor is yours. Good morning.
Good morning. I'm just going to pull up my notes here. And through you, Mr. Chair, as you'll see in the quality section of the report, the chart in your package remains unchanged since we last met, as CIHI hasn't released any updated data. So nothing new to share in that regard. However, I'm really pleased to share a snapshot about what we have planned, and we'll be providing you with more details and updates through the year. So we're working on, through the clinical and quality areas, we're working on 4 primary projects that have been based on the assessments Renata and I complete when we do our monthly operational reviews for each care community, as well as supported and funded, in some cases, initiatives from the Ministry of Long-Term Care, and along with some of the requirements of the Fixing Long-Term Care Home Act. So all of those assessments allowed us to identify these 4 key areas. And first is the palliative care approach. So the requirements under the new act have been expanded to add a new right to the Residents' Bill of Rights to ensure every resident is provided with care and services based on a palliative care philosophy. So this is not just alone in long-term care, but this is a philosophy that primary care, as well as all, Ontario has a framework. So we're part of a bigger project. But essentially, each resident is to have a care plan to ensure quality of life improvement, symptom management, psychological support, and end of life care. We do much of this very well already. However, in 2023, we have new tools, education, and resources for our residents and families, caregivers, as well as our long-term care staff to support the philosophy to ensure a broader, more holistic approach to care. The second project area is medication management. The ministry is funding a 3-year medication safety technology program. Well, Jen talks about acronyms, that MSTP. Currently, it's in its 2nd year to support homes in obtaining technology to improve our medication management systems. So in the report, you'll see, just giving you a highlight here, that there are 3 areas of technology that we're going to focus on this year. And we're implementing this with our medical directors, our attending physicians, and our registered staff. The first is physician engagement, where physicians can access resident charts wherever they are, and they can send secure conversations 24/7 between the physician and long-term care home team to deliver timely and well-communicated next steps to support our residents' care. And as you know, many of our physicians that support our medical directors work in the ER, so sometimes that's 4 in the morning they're sending that, but they have access to the resident charts and can communicate. So it's a really good tool, piece of technology. We also are implementing eConnect Plus, where we can access labs and imaging records as soon as they become available, right to our medical, electronic medical records. So no waiting on faxes or mailed reports as we've done in the past. And this easy access to information helps our team to make timely and informed clinical decisions, supporting really good quality care for our residents. And finally, online medication incident reporting. And this technology ensures timely reporting of medication incidents that's shared with our pharmacy, nursing leaders, or medical directors in order to receive a rapid assessment, analysis, and an action plan. And so again, that technology is really supporting delivering the best quality care. So on from technology, another significant project is skin and wound care, both with the nature of aging skin and the increased complexity of residents moving into our home. We're seeing increased skin and wound treatments being required. But we also know prevention and early detection is also a key component. So we're looking at a comprehensive skin and wound program. So in 2023, staff and program areas are receiving additional training in skin and wound care, along with enhancing our registered staff knowledge and treatment modalities. And all homes will be maintaining a skin and wound lead with additional education and training. And finally, the last project area is resident care documentation. It's all about documenting and communicating, and point-click care is the electronic medical record software we use with our 3 care communities. In 2022, all homes built the foundation by developing what we call PCC super users. They know how to use this electronic medical record. And this year, our PCC super users will be helping us to roll out new standardized and comprehensive resident care assessments using clinical decision support tools that are based on best practice. So, and stay tuned, Grey County just signed on for Project Amplify, which will enable better clinical information sharing between our long-term care homes and acute care facilities, ensuring that smooth transition and communication for a better resident experience during those places where we're both involved in the care. So it's going to be an exciting 2023 because I feel, as we say, that we may be on this world of recovery and getting into projects and really building that capacity is an exciting place for clinical and quality. So that's the end of my report. If any questions.
Thanks very much, Dana. And thank you for lending your expertise to the provincial best practices table. Very much appreciated. A question from Dana's report. Sue, go ahead, please.
Thank you, Mr. Chair, and thanks, Dana. Can you just speak to like medication management? So would that if a patient was transferred to the hospital,
Mhm.
would the physician in the hospital be able to access that, or is it only between the homes?
So the present structure that we do when one of our residents is receiving care at the hospital, we have a process by which we're communicating that transition to care. So right now it would be paper based, so they're released with a record, but the communication is ongoing every day. We're checking in with the hospital and the care. Going forward, we're hoping with Project Amplify that record, they would be able to see what we are seeing in long-term care, and we're able to see the transition, sort of the high level, what they're receiving in the hospital. So that's where we're headed. One of the unique benefits, particularly in some of our smaller, more rural communities, is that the physician, maybe I'll look specifically to Greg Gables, the physician who is your primary care physician is also the physician who's treating you at the hospital, who is also the physician who sees you in your home. And so we're blessed by some of that continuity of care. But yes, the communication and Project Amplify is intended to do that. Right now, we just have to make sure that our software PCC is communicating with what the hospital uses, which is called Cerner. And so as soon as those two companies are making, and that's what they're working on right now with Project Amplify, we'll really be able to see the exact treatments and medications receiving. Did I answer your question?
Did, thank
Okay.
you. Yeah.
Any other questions for Dana? Mr. Warden, go ahead.
Thank you, Mr. Chair. Thank you, Dana, for the report. So what you were talking about there earlier, just at the end there about Project Amplify, is that in a continuation of the efforts to wean us off fax machines in the healthcare system?
Yeah, I think in general, technology, it's about easy access. It's about ensuring secured communication, as well as reducing the steps from a lean process. So that's absolutely it. Within the scope, if I may, about the e-privacy. So when we do take a look at all of this, we're required to really maintain our privacy, ensuring only those that need to know have access to that information. So that's also part of it. Things left on fax machines. I can assure you, we've got secure fax machines, but in all of that is really supporting not only delivering resident care, but delivering safe, secure communication in a timely way. So technology is going to, we can't stop, and there's a lot of good opportunities. But yes, it's indeed to get rid of email and faxing and really make it secure, and the ability for it just to go directly into a client record like lab results and x-rays. What an amazing process. So exciting times, as I said. I am excited, seem excited. Not that I'm a tech wizard, but there's processes in place to support our team to make it happen.
Very good. So I like that. And if I make, Mr. Chair, that leads me to my next question, and it relates back to our council meeting last week when we had a report on technology security. And I'm trying to think, was it Evan, I think, was that gave that report last week? Is he working or aware of this project? And I guess is he yeah, I think what my question is. I'm just not spitting it out very good, but I can see Jen wants to, or whoever wants to respond would be great, please.
I think Jen was able to read your mind, Mr. Warden. Go ahead, Jen.
Thanks.
I'm an open book to the world.
No, and it's a good question. And we have a regular, it's either monthly or every other month. The time blurs together, but we meet regularly with our partners in the departments across the county. So we have a meeting where we have a high level look at all the projects that are going on. It includes IT, human resources, finance, and the executive directors. And so we definitely are working on that together because it's important that we don't do something that impacts negatively to the work that our partners in our other departments are working on. So yeah, they're involved and a key part of that process.
Excellent. Thank you very much.
Any other questions for Dana? I'm not seeing any. We'll move on to Stacy for compliance and outbreak. Morning, Stacy.
Good morning. Through you, Mr. Chair, I'll report the updates on inspections and also outbreaks in the care communities. So Lee Manor had an inspector on site for a total of 7 days who conducted a follow-up inspection to previously reported critical incidents related to falls that occurred in 2022. And the inspector was on site to follow up to a complaint and included an IPAC inspection as well. During the inspection, the inspector made observations, reviewed records, conducted interviews, and utilized applicable inspection protocols. And we're very pleased to share that following their very comprehensive review, that there were no findings of noncompliance. And I'll also draw your attention to the outbreak section of the report. And you'll notice that all 3 care communities experienced outbreaks during the reporting period. And over the past 3 years, we've become very responsive to early detection and work closely with our partners at Public Health to manage and contain outbreaks. And while we are dedicated to ensuring IPAC best practices, we also prioritize and balance quality of life for our residents during these periods. And as Jen mentioned in her report, we recently added additional expertise to our teams and welcomed IPAC and wellness leads in each of our care communities who've been with us for about 6 months or 6 weeks now. And their specialized knowledge and skill will prove beneficial to enhance quality and safety in our homes.
Thank you, Stacy. Questions from committee members? Not seeing any. We'll move on to Shannon, who is going to speak on the events and occupancy and projects. Morning, Shannon.
Good morning. Thank you. And through you, Mr. Chair. During this reporting period, the residents had lots to celebrate and entertain to enjoy. Christmas is always a huge month of celebrations, and this year was no different, but all 3 homes have started off this year with some amazing programs. Rockwood Terrace had their Super Bowl party, which included pizza, sports trivia, and of course, the big game. And they have also shared in this report the amazing video of every second of the year. Lee Manor celebrated the Hockey Day in Owen Sound alongside the Owen Sound community. Residents enjoyed a variety of programs, including table hockey, trivia, and a mobile photo booth. Grey Gables residents and staff went on a week-long Love Boat cruise. We spent the time ziplining, playing games on the deck, and enjoying some tropical drinks by the pool. And we had some entertainment by Elvis to end the cruise. So that was an amazing week, and it was shared definitely on the social media with some great responses. Next, I'd like to draw your attention to the occupancy report on page 19. The homes need to have a 97% occupancy at the end of the year in order to receive full funding. You will notice Grey Gables is sitting at 91%. This includes the BSTU. As we are filling it, it is protected as a specialized unit. So regardless of the actual occupancy, Grey Gables is not required to meet a specific target for resident days to receive full funding, because we fall under the title of a designated specialized unit. And that's the end of my report. If there's any questions.
Shannon, can you just give a brief update on the behavioral unit, how things are working in that unit? And
Yes, for sure. So we're actually progressing along really well. We have 12 residents right now that are actually part of the BSTU. We do have a report that we're kind of waiting on for the trial to continue. So we've put in an application to have it continue on, and we should know, and I'm not sure if Jen wants to report a little bit more on that, but we're still we're actually admitting 2 this week into the BSTU as well. So we're continuing to fill those beds, and and it's going to be a year by the end of March. So we'll have a little bit of a celebration to end that trial period.
Are the residents' needs being met as the program was designed for?
Yes, they are. Actually, we're finding a lot are coming in. We have probably, I think we have 4 right now that are ready to transition out, but we're working with our partners with HCCSS to try and get them placed, but they are on a waiting list as well for another home. So, but yes, we are definitely meeting their needs. A lot of it is medication, and then their behaviors, of course, and we have upped our staffing levels for that area. So they're taken care of. Yes, for sure.
The specialized training that the staff were involved with, are the staff enjoying the unit?
Some do, some really excel in that unit, and others don't want to work there. So, but we have, everybody has bid on a line. So they are working. So the ones that want to work in there are the ones that have their full-time lines for that area. Yeah.
Thank you.
So yeah, it's definitely a mix, and but they're loved just the same as all the other residents are. So they still come out, all of them come out to our programs that we have. If we're doing a program in our center core here, they all come out and enjoy it. And yeah, it's well managed, and yeah, so it's good.
Well, I'm glad to hear that. It's certainly a needed unit, you know, where people get the specialization that is required to deal with their specific needs. So thanks to everyone involved with that unit. Okay, any questions for Shannon? Sue, go ahead.
Thanks, Mr. Chair. I just want to say my social life is pretty low key compared to what's going on in the 3 homes. And I do want to say kudos to all staff, because it's almost part of your work day to make those events happen. And I'm sure that the people in the homes really appreciate it. So thank you very much.
Oh, you're welcome.
Well, I'm sorry, Sue, that Dane, go ahead.
Thank you, Mr. Chair. A quick question on occupancy and for Grey Gables. And Shannon, you were saying that because Grey Gables is a designated site, it doesn't require that 97%. If we take the behavioral unit portion out, is the rest of the facility operating at the 97%? Or yes?
Oh,
that was
sorry.
a simple answer. Thank you.
Sorry, I can let Jen answer too.
Sure, through you, Mr. Chair. I'll just add, we had attempted to do to add another column in this chart for this reporting to distinguish between the 2 units, but it was proving to be a little bit complex. So moving forward, though, we will be able to put 2 separate columns in the chart to show the BSTU and then show the traditional beds occupancy, and it'll just make it a little bit clearer moving forward.
Just to follow up, Chair, thank you. So when it comes to funding for Grey Gables, then the 2 sides, the 2 different portions of the units, they are funded completely separately as long-term care beds versus the behavioral units section?
Yeah.
Thanks. So yes and no. So all 66 beds have the base funding as the traditional funding, and then the 20 behavioral support transition unit beds have additional specialized enhanced funding. And we are planning to bring a report forward at an upcoming meeting where we can dedicate some time to doing some reflection. We'll give you an update on the progression of the unit and what the future of the unit looks like.
Any other questions? Just one follow-up. Shannon, you talked about a couple of people waiting for other homes to open up. Can someone just talk about occupancy in general throughout Grey County? You know, we've had the new program open up in Owen Sound. Has that taken some of the heat off the wait list, or are the wait lists still as long as they've ever been? Jen?
Shannon, do you have a sense of your wait list right now?
Yes, well,
Okay.
We're at about 187 residents on our wait list right now.
Okay. So through you, Mr. Chair, I will look and circulate for committee the most recent, what I can find is of the most recent data from Home and Community Care Support Services that does highlight the wait list for Grey Bruce. So I will pull that up and circulate it. I looked at it, I had it pulled up for orientation for committee, and that information was as recent as June the previous year. So I'm not sure that it's been updated, but I will look and circulate. I can say that locally in Grey Bruce and then regionally in the Legacy Southwest, that's part of Ontario Health West, there continues to be an intentional and very focused efforts on access and flow is the language that Ontario Health uses. It's that transition language. We talk about things like resident or patients that are designated alternate level of care. And so this does continue to be an area that needs work and is being focused on, is helping people to be in the right place, getting the right care at the right time. And so there does continue to be people living in hospitals that are waiting for placement, people that are in community waiting for community care, or in community waiting for placement. So I don't think that has eased significantly over the past few months.
Thanks, Jen. That would certainly be, at least the communication I get from members of the community. It's very frustrating when they have loved ones that it just seems like a long time to get them into the appropriate settings. And, it can be very troubling and very taxing on family members that are, on that wait list. So thanks. I'm glad that work continues. Okay, I think we'll move on to Karen now. Karen's going to speak to us on the healthcare partner inspections, environmental summary, and the color it story. Good morning, Karen.
Good morning, everyone. Thank you, Mr. Chair. You will see in the report, we've had a few visits from health system partners during the reporting period. An inspector from TSSA attended Grey Gables to inspect their elevator, and there were no deficiencies noted. Grey Gables also had the fire and safety company in to inspect the fire alarm system and associated programs, and any deficiencies noted have been addressed. And Grey Gables also had public health in to do an IPAC inspection. This is fairly common if a home is in an outbreak, that we see public health will attend and complete an IPAC audit, and there were no findings. Both Lee Manor and Rockwood Terrace had an inspector in from the Electrical Safety Authority. These folks come in and review any electrical items team members have completed that we are required to log. And both homes had no deficiencies identified. I believe I talked at the last meeting quite in depth about environmental and emergency preparedness and updates made to the Long-Term Care Homes Act, or the Fixing Long-Term Care Act. Monthly fire drills were completed on each shift during the months of December and January in all 3 homes. And all 3 homes also worked on some code reviews during that time with updates that had been completed in our manual review. To end the part of this part of the meeting, I'd like to highlight some of the color it stories noted in the back of the report. Grey Gables and Rockwood Terrace both are highlighting events over the Christmas blizzard, and in some ways it feels like a long time ago already, but both homes seen some very dedicated staff in Grey Gables who arrived to work on Friday with their suitcase, just planning to stay, knowing that their services would be required. In both homes, everyone pitched in. We had employees opening up their homes for other employees to stay at. here at Rockwood Terrace, our maintenance guy who managed to get in on Christmas Day, dressed up as Santa and helped deliver some joy to the residents. We had neighbors plowing our walkways and offering to help with that. And we also had a former team member came in and provided some assistance at mealtime. So it was really good to see. Lee Manor highlighted a very unique situation, and I'm sure any of the farmers in the room can attest that this would be pretty special. They had a gentleman who had been waiting for an internal room change, but he wanted to stay with the same care team. So sometimes that takes a little while to find the right room to open up in the same area, but eventually that happened. The resident jokingly requested that the room be painted in John Deere colors, green and yellow, to honor his lifetime of farming. And although that request couldn't be met exactly, the team there took this as an opportunity and sourced and purchased some John Deere decor, including yellow and green balloons, some streamers, and big John Deere logos. They also printed posters of tractors similar to the one this resident himself owned. And move-in day was pretty special. It sounds like there was quite an entourage to accompany the resident to his room. And the resident was speechless and teary at the sight of what the staff had done to make his move and room special. So kudos to the Lee Manor team. And that is the end of my section of the report.
Thanks very much, Karen. I hope it didn't open up a debate between John Deere, New Holland, and Kubota, but that's wonderful that you're able to do that. Mr. Warden, go ahead.
Oh, thank you, Mr. Chair. I was just going to note on that last piece there that the gentleman that moved, and of course I wouldn't know him, but I'm sure he's a gentleman of high mechanical ability, because it does take that to keep those green machines running.
Here we go. Other questions for Karen? Karen, one question. You mentioned staff that went above and beyond, brought their suitcases, other staff that opened up their homes so people could go and stay there in the event of the storm. Are we able, how do we recognize individuals that go above and beyond like that?
Well, certainly at the time, verbal thanks goes a long way. And the other homes might have done some different things here. We provided meals to staff members who were here working. There was also some benefit payment wise that HR worked with us to provide. And we issued color it cards to everyone who had went above and beyond during that time frame. And I don't know, Shannon and Stacy, was there anything extra that one of you might have done?
No, you captured it all. Yeah.
No, that's great. Appreciate, certainly the staff for going above and beyond, but it's nice to make sure that we're recognizing them. All right. Well, any other questions for Karen? I'm not seeing any. So we'll call the question on the operational report. All in favor? That is carried. So we have a closed meeting session. But Committee of the Whole now goes into closed session pursuant to Section 239 sub 2 of the Municipal Act 2001 as amended to discuss personal matters about an identifiable individual, including municipal or local board employees, LTCR CM 09-23 closed session report July to December 2022. Can I have a mover to go into closed? Moved by Councillor Carlton and seconded by Councillor Hutchinson. Who is every